Lynn, this question comes from one of the three committees in the House of Representatives that was laboring over the health care legislation. And what the congressman's representative asks, she says, Lynn, the fact of the matter is that there has been a huge amount of time and energy debating various aspects of this legislation, all 1,000 pages of it. She says, undoubtedly, the medical review board aspect is completely unacceptable. And I agree with you, it is a Nazi policy. She says, but beyond that, even the aspects of the bill that we are fighting for instance, the public option, is indeed completely unworkable. And in fact, in the way that this is currently being discussed, the fact is that the public plan or the public option would end up as a dumping ground for the sicker and more expensive citizen. And if that happens, obviously, then what you'll get is a turnaround in which everyone says, oh, you see, this was a bad idea, you can't have a public option, you can't provide for people, etc. She said the fact is that we can debate this endlessly, but I think we have to accept the fact that this bill was never intended to provide adequate health care for the vast majority of the U.S. population. The fact is that the debate itself is becoming increasingly ludicrous. Our proposal, and I cannot promise you that we will raise this in September, especially given all of the time that has been put into this, but our proposal is to step forward and basically say, in the most diplomatic terms possible, that this bill is a piece of crap. And it doesn't work. And it won't work, that it can't work. That solving the healthcare crisis really is not that complicated, despite what everyone says. That the only thing that is workable, that is affordable, and that is just is to adopt a simple program of Medicare for all Americans. I don't see why it wouldn't work. It would cost a lot less than any of the proposals on the table, and it would not require the withholding of care from any American. What are your thoughts on this?
It's fairly simple. We'd simply cancel the HMO legislation, go back to a complete national policy of we had before, Hill-Burton, and provide for funding for implementation of Hill-Burton. If you go to building up the medical institutions of the United States, as we did under Hill-Burton, with those kinds of numbers and objectives, that should be what we do. That's the first thing. Cancel the HMO. The HMO was a piece of fascist legislation. It wasn't as violent and as fascist as Obama is. This guy's off the wall. But it was a sneak-in fascist reform which was to take insurance companies and let insurance companies milk the sick. So go back to Hill-Burton. It's cheaper. Well, I know I had some experience with the general hospital system before it existed. We had general hospitals in the military. And I did some time in serving as on a ward and so forth in one of these hospitals. And the system is far more efficient than anytime you put in a turnstile, where you have to put coins in a turnstile to get someplace, you have lowered efficiency. What you do is you have an institution which has the capacity to deal with the problem, which is what Hill-Burton allowed for. Hill-Burton is the model, which is based on the experience of the United States, especially in the post-war period, on the basis of what we did in the military. We had around 17 million people in service in the U.S. military during World War II. 17 million people. We serviced this population with a system, a healthcare system, which essentially was the same thing in respect to the soldier as Hill-Burton. Hill-Burton was already in gestation before it became a national legislation in that period. The problem is building back to that, because we don't have this staff anymore. We don't have the philosophy. We have some residue of it. Take the whole thing and shut down HMO. Take the insurance companies out. Get rid of the insurance companies. We don't need them. They're only looting the sick, that's all. And it's part of a genocide program. It's the first step, it's the stepping stone on which the Nazi healthcare policy of President Obama is based. The Nazi crime policy, crime against humanity policy of the Obama administration. So ban Obama. Tell him to keep away from hospitals. He might get a disease. Or maybe he has one already. But anyway, so that's the way to go at it. You need a national Hill-Burton restoration. The way you get that is you go back and you kill the HMO legislation. You kill everything that pertains to that. You put the insurance companies under scrutiny for fraud, fraudulent practices. And they are fraudulent, even though they were done under law, because the intent, the purpose served is in the judgment of honest people fraudulent. Just because something is legal doesn't mean it's good. Like some of the Hitler laws. They were legal, but they weren't good. Like Obama law. So legal, but no damn good. Huh? So that's the way I think we have to approach this. And whatever is required to fund that kind of program, a restoration of Hill-Burton, applying Hill-Burton philosophy of government responsibility on each county level. You've got to watch this cutting down of number of hospitals. You've got to have each county has to be covered, because people get sick in their county. And they have to travel if they're sick sometimes, emergency. It has to be in the county. Has to be in the county. And are accessible to the county as a county operation. In that case, what we have to do is rebuild our system in terms of technology. Again, we have to go to the future. We have a larger world population. We have new diseases. We have all kinds of requirements which require a future orientation of medicine. And that's what we should put our effort into. The future. The future. We have to keep people alive who are valuable, who are dying on us. Obama doesn't understand that. He doesn't. See, Obama has no conception of the value of a human being. He doesn't know that human beings are essential, that they contribute something. Their development, their health, their minds are important. Human beings are the most valuable thing on this planet. The more of them, the better, if they're developed. So make sure they're developed. Take care of them. Every time someone dies, something within them dies. They can't contribute anymore. You have sicknesses where people deteriorate. They don't function mentally and otherwise because of lack of the proper medical attention or development of the techniques to deal with that. We lose minds. We lose skills. It's wrong. So we have to have a future orientation, as I say in everything. You need to think at least 50 years ahead. And your test of whether you're sane or not is whether you have thought competently 50 years ahead. And under these conditions, then you take something like a healthcare problem. We've got to think 50 years ahead of we've got to think, for example, let's take the question of space problems. We had more technology developed by the space program, about 10% or 10 cents for every penny we put into it in terms of that. We have to think about starting from 50 years ahead. Science, space medicine and look at what we're doing to putting man in space. If we take the question of what is required to keep a human being safely in flight, in space, in that kind of environment, under constant gravity, a relativistic condition of life in terms of magnetic and gravitational conditions, and think about we're facing that kind of thing, that will take us to the edge, the frontier edge of where medicine should go today, where medical care should go today, science should go today. So we need a future orientation applied to a Hill-Burton philosophy in terms of county by county accountability. And that's what we should pay for, and nothing else.